study was commissioned to Hommes and CISMAI by the National Ombudsman on Children and Adolescents in 2019. And the aim of the study was to fill the gap of the lack of data on child maltreatment in our country, as well as to respond to the several recommendations made to Italy by both the UN Committee on the Rights of the Child and the World Health Organization. The duration of the study was between 2019 and 2020, and we refer to data related to year 2018. So we have the picture of child maltreatment in our country on 2018. With regard to the methodology, we collected data coming from the social services because these are the services in charge of taking in care children vulnerable. And at the very beginning, our sample was made of 250 municipalities that were the same that joined the first survey that we conducted in 2013. Unfortunately, due to provisions coming from the National Authority on Privacy, we had to partially change this sample, and also due to some difficulties for some municipalities to join the work, we had to change the original sample, so that at the very end we had 196 cities joining this survey. With regard to the main findings, we had that regarding children in the care of the social services in Italy, we have that every 1,000 minor residents in our country, 45 are in the care of the social services because they are vulnerable, which means that 401,766 minors are in 2018 in the care of our social services because they are vulnerable. If we have if we make a focus on those in the care of the social services because they have been victims of one or more forms of maltreatment, we have that every 1,000 minors in the care of the services, 193 have been victims of one or more forms of violence, which means that 77,493 minors in Italy have been victims of violence in 2018. So according to this data, we can say that the epidemiologic dimensions of the phenomenon of violence against children in our country is 9 minors every 1,000 residents are victims of violence. The very added value of this study is also that we can make the first example of monitoring of violence against children for 170 municipalities that were the same that joined both the survey that we conducted in 2013 and 2018, because these cities tell us how the trend of violence was during this 5 years period. And here we can say that we have an increase of both the number of minors who were vulnerable and in the care of the social services, because here we have an increase of 3.6%, and also an increase of the number of children who were victims of violence, of maltreatment. In fact, in this case, we have an increase of nearly 50% in the 2 years.
The collected figure provides us with a precise overview, a formal overview of the phenomenon. As we know, this data highlight a part, but in any case excessive part of the maltreatment situations. We are referring, obviously, to reported and official situations. Another focus should be done on black number of not reported cases. We would like to use this kind of studies to facilitate the disclosure, cultural disclosure, not only through our children, but even through professionals, generating a specific cultural approach to child abuse and neglect. Anyhow, given the qualitative nature of the results, we do need to focus on the typologies of violence under its several forms. Who are these 9 out of 1,000 children victims of maltreatment? The most widespread form is neglect, which in Italy takes on the broadest definition of pathology of care, a definition after which this dossier, this study, has opened a discussion for a greater consistency with international classifications. This type of maltreatment, pathology of care, concerns more than 40% of cases. Witnessed violence concerns 32.4% of the children involved. Psychological maltreatment follows with 14.1%, physical maltreatment with 9.6%, and sexual abuse with 3.5%. The recognizability of the typologies is fundamental neglect, witnesses violence, and psychological and physical maltreatment represent the first element of attention and intervention in almost 70% of cases. Less recognizable typologies such as sexual abuse and psychological maltreatment are often reported when children are taken care in a later stage, thanks to the intervention of the professionals involved. But this, as we know, it's not the best way. We need to invest more and more in prevention and early detection as key factors. Maltreatment is often reported in a multiple definition. More than 40% of the investigated cases show multiple maltreatment coherently to the experiences on the subject. But who are the perpetrators? The research provides us with very clear data consistent with the evidence present in the scientific literature on the subject. More than 90%, 91.4% of the perpetrators are family members or close to the family. How can we reach out to these children? Who reports the maltreatment? The multidisciplinary approach and the activation of the services under an ecological model key, as well as the great training, cultural and awareness-raising activities carried out by the association, dealing with the protection of minors and women in particular, allow to gain a great ability in identifying the phenomenon and consequently to generate a report. The school and educational agency, as well as the association, are a powerful ally for the protection of children, alongside more institutional level. What services can victims access to? How can we answer to the identified need? Families mainly receive financial assistance and parenting support as primary type of care at their home, in specific, and thanks to educational and psychological support services. Less than 40% of child victims find a solution out of their families. Italy reports one of the lowest rate of removal at the European level, as evidences in this study and in the annual reports of Child Rights Convention. The study clearly highlights how early detection is a strategic protection key. Therefore, it becomes essential to invest in training and to improve and empower basic services by promoting the dialogue with the many realities present on the territory, within a framework that adopts the ecological model and promotes transversal, inclusive, competent, and brave strategies.
I am very happy to have been able to participate to the launch event of this new report on the maltreatment and violence against children in Italy, conducted by Terre des Hommes and CISMAI. I think this is an analysis that really sheds an important light over the situation of the phenomenon in the country, and that unfortunately shows how violence against children, it is still a very common and widespread phenomenon. And from my position of European Commission coordinator for the rights of the child, I can only confirm that this is very much a trend that we observe in different countries at European level and globally, with violence against children in all its forms being still very, very common. A high number of children are impacted by violence, and they can be impacted in different roles. Children can be victims of violence, they can be witnesses of violence, and this is the case especially in domestic violence situations, and they can also be the perpetrators of violence. And we know that violence in schools and violence among peers is on the rise. This is the reason why one of the priorities of the recently adopted EU strategy on the rights of the child is exactly the prevention and the fight against violence on children in all its forms. The European Commission, in fact, adopted its latest strategy on the rights of the child in March 2021. So it's a very new document that sets forward the program, the plan, and the actions that the European Union intends to undertake in the coming years to do more to protect and promote the rights of children, both within the European Union and outside of the European Union. With this strategy, we want to really put children at the center. We want to have child-friendly culture in the European institutions. We want to bring children's voices into EU policy making. And this is also the reason why we have consulted with more than 10,000 children ahead of the strategy, and we continue working with children in the implementation of the strategy. Going back to the issue of violence against children, which we've heard and we've read in the report being still very widespread. One model that the European Union action has contributed to spread across the continent is the Children's Houses model, or the Barnahus model. This is an idea, a project originated in Iceland many years ago and then gradually extended to the Scandinavian countries and then further to other EU member states. And it consists in an example of integrated child protection system, whereby a child is taken in charge by all the services that need to work together to help the child victim of violence in an integrated way and in a multidisciplinary and interagency way. So essentially, they're often houses that are very child-friendly, where the environment can put the child at ease, and where different services from law enforcement, the judiciary, the medical services and healthcare, but also psychological support, social services, they all work in that very same place with the child at the center to make sure that a child who, for instance, is or has been victim of violence doesn't have to suffer from further trauma after having been a victim. So this is a concrete example of how EU support and also financial support has been working towards responding to the phenomenon of violence against children. And in conclusion, I would like to recall that with our Daphne program, which is the European fund which is administered by DG Justice, the Department for Justice in the European Commission. We've been for a number of years now having yearly calls for proposals to support projects and initiatives aimed at preventing and combating violence against children. Our 2021 call for proposal has just been launched. It will be open until mid-June, and it's available on our website. Thank you.
The violence against women and against children, it's a pandemic within the pandemic of COVID-19, which the world is experiencing. As suggested by the data collected by Terre, Hommes, Italia and CISMAI, it's evidence that the phenomenon of violence against children, which was already pre-existing in Italy, has been exacerbated during the time of COVID. And the months of lockdown have had devastating consequences for individuals, for our societies and for the economies at large. Just to recall that the data from the global report published in 2020 by WHO on preventing violence against children identified that actually 1 child out of 2 is subject to violence during his childhood, and 1 child out of 4 is actually living with a mother that is experiencing violence. So this is a phenomenon that has really dramatic extension across countries, across regions of the world, and unfortunately including in Italy. the critical reflections that come from analyzing and thinking about the report published by Terre, the excellent report, and that are recommendation also for the Italian government to take action, is number one, as already identified by the Committee on the Right of the Child, Italy does not have a systematic way of collecting data with a nationally represented sample on violence against children together with violence against women. And the study from Terre is actually the only one that exists that is executed and comparable in different years. So it's very important that these surveys are becoming part of the national way of measuring what is happening in the social fabric of among Italian youngs. And also, one other element that is emerging from the Terre survey is that between the two surveys of 2013 and 2020, there is a significant increase in the experience of witnessing violence. So there are significantly more children that are witnessing violence in the domestic environment where they live, around them. And that is extremely worrying, because we know from the scientific literature that if a child experiences and witnesses violence during his childhood, he is twice more likely to become a perpetrator if he is a boy, and twice more likely to become a victim of violence if it's a girl. So these are the two key messages about the importance of the Terre report. In addition to that, as a suggestion for better responding to violence, especially during the current pandemic, many countries in the world have experienced with forms of social protection that we call conditional cash transfers, or cash transfers that are linked to social protection mechanisms. For example, in Latin America, Chile and Colombia have used this conditional cash transfer to actually support women during the time of the pandemic and allow them to have more economic freedom to decide, for example, if they are living in an experience of domestic violence, to have the economic independence for actually finding a solution. And that is also something that Italy could think of, because we have in Italy a system that is called the basic income, the reddito di cittadinanza, and this could function as a basic social protection scheme if it was added a targeting to women, because that will give women the independence, as we have seen in other countries. And we have seen that in other countries, these conditional cash transfer, they act on the independence, and they also act on reducing violence against women and the domestic violence. The final point that I'd also like to say, and this reflection, having seen the excellent report by Terre, is together with what we call the Lancet Commission on Gender-Based Violence and Maltreatment of Young People, which I currently co-chair with Professor Felicia Knoll from Miami University. When looking at this phenomenon of violence against children and violence against women, we are initiating an analysis that we call the cost of inaction, which means we need to really unpack what are the economic costs that society are undertaking because they are not responding, they are not preventing, they are not dealing with the problems of violence against children and against women. And this particular analysis of the cost of inaction, we are also thinking to apply it to the situation in Italy, and maybe to provide that as a stimulus for additional effort and additional actions for the Italian society. We believe that this is really the appropriate time. In the medium and short term, we absolutely need to tackle this pandemic within the pandemic of COVID-19, and we need to take action. Thank you.